This is the large intestine, and this blue section is called the sigmoid colon, which is located just before the rectum. What happens when a cancer develops in the lumen area of the sigmoid colon? A sigmoid colectomy is a surgical procedure that removes this section of the colon and reconnects the descending colon to the rectum. It is commonly performed using minimally invasive or open surgery to treat colorectal cancer or severe diverticulitis, a condition in which small pouches in the colon become inflamed or infected. In a laparoscopic-assisted sigmoid colectomy, the surgeon begins by inserting 3 small ports into the abdomen. These ports are typically placed near the belly button, which is the umbilical port, the second one in the upper right abdomen, and the third in the lower right abdomen. The surgeon begins mobilizing the sigmoid and descending colon and releasing the peritoneal attachments to mobilize these sections of the colon to make it ready for the procedure. Then the inferior mesenteric artery is identified and sealed, usually with an energy device, to safely stop the blood supply to the diseased segment of the sigmoid colon. The second stage of the surgery is performed through a larger incision in the lower left side of the abdomen. Through this opening, the surgeon gently brings the lower end of the sigmoid colon outside the body for better access. A linear surgical stapler is then used to divide the sigmoid colon from the rectum at the recto-sigmoid junction, creating a secure sealed closure while separating the diseased section of the colon. The mobilized proximal sigmoid colon is gently brought to the abdominal incision. A surgical clamp and an electrocautery device are then used to separate the sigmoid colon from the descending colon, allowing the diseased section of the colon to be completely removed from the body. The anvil of the stapler is placed in the distal descending colon and secured with a purse string suture. The stapler is inserted through the anal canal into the rectum and advanced until it is flush with the closed end. As the device is locked into place and fired, it punctures through the stapled rectum and secures the anastomosis. The circular stapler is removed from the rectum. All ports are removed and closed with sutures. The left lower quadrant incision is closed with additional sutures. Thank you for watching. If you found this video helpful, please subscribe to the channel and like this video. Your support helps us create more high-quality medical animations and educational content for everyone.